I'm Lauren Meffin, speech pathologist. Let's take an inside look at something that has happened in one of my patients that I can honestly say in the last 10 years I can't recall seeing. So, what I'm doing is I have a fiberendoscopic swallowing view of this patient. I have a camera placed in their nose and I'm taking a look at their swallowing. I want to see how their muscles are helping to protect their airway while they are eating and drinking. Now, one of the most phenomenal things happened. Over here, on the left-hand side of the screen, you see this kind of tiny white bulging. I'm going to play a quick clip.
Good. Good. Now, nice palm.
I found this fascinating. So, what is it? Well, I discussed it with one of our physicians. I asked, what is that I'm looking at? Because as a speech pathologist, we are not able to diagnose, but I felt confident that it wasn't anything of major concern. I had my suspicions on what it was, but what I'm looking at is a tiny little tip of the patient's hyoid region or hyoid bone or hyoid cartilage. So I enjoyed that swallowing study. The patient enjoyed it, and I also learned something. I think that provides us a valuable lesson because I always tell my patients, one of the reasons that I come to work every day is to learn from you. We as clinicians don't need to have all of the answers, but what we do need in this world is an amazing team of providers. When working with the patient who has undergone radiation therapy to the head and neck, we need amazing radiation oncologists, we need ear, nose, and throat physicians, we need oncologists, we need registered dietitians, physical therapists, and dentists, amongst many other areas, including psychological support, and of course, our primary care physicians. So always remember, you don't have to know all the answers, but if you don't know the answer, as a clinician, you should ask. You should ask your physicians because they are the doctors there to support you and they want nothing more than your patients to make amazing progress. Continue to follow us as we explore and learn more. One more fact. Is this concerning to me? No, it's a normal for that patient. Not concerning at all. I'm not going to treat it. I'm going to leave it alone. It doesn't impact swallowing. It doesn't impact changes to this patient, and there are no complaints related to their voice. So, just a peculiar new normal.